Hi, my name is Brianna Valencia. I'm going to talk and explain depression, symptoms, statistics, and treatments. This video presentation is for my college psychology class. I'm going to start with this question. What is depression? According with the Mayo Clinic website, depression is a mood disorder that causes a persistent feeling of sadness and loss of interest. Depression is also called major depressive disorder or clinical depression. Symptoms. All of us had felt sadness more than once in our life, but in order to be diagnosed with depression disorder, an individual must be experiencing 5 or more of the following symptoms during the same 2-week period. Depressed mood most of the day, nearly every day. Markedly diminish interest or pleasure in all or almost all activities most of the day, nearly every day. Significant weight loss when not dieting or weight gain, or decrease or increase in appetite nearly every day. Significant change in the sleep-wake cycle, having difficulty falling and or staying asleep or sleeping too much. A slowing down of thought and a reduction of physical movement, fatigue or loss of energy nearly every day, feelings of worthlessness or excessive or inappropriate guilt nearly every day, diminished ability to think or concentrate or indecisiveness nearly every day, recurring thoughts of death, recurring suicidal ideation without a specific plan or a suicide attempt or a specific plan for committing suicide. According with the Diagnosis and Statistical Manual of Mental Disorder, there is new specifier to further classify diagnosis. Depression with mixed features. This specifier allows for the presence of manic symptoms as part of the depression diagnosis in patients who do not meet full criteria for a manic episode. And depression with anxious distress. The presence of anxiety in patients may affect prognosis, treatment or not. The individual experiencing depression also present with anxious distress. How common it is. In 2020, an estimated 21 million adults in the United States had at least one major depressive episode. This number represented 8.4% of all U.S. adults. Implications. Negative consequences experienced by the person. Bad sleep habits, loss of appetite, or the opposite, fatigue, headaches, and back pain. These are some of the implications that family and friends affected by a loved one experiencing depression. Angry, feelings of powerlessness, irritated, and also feeling guilty and ashamed for getting upset with their depressed loved one. Treatment. The treatment for depression can be medications. In this treatment, it's important to find the right medication. Also, psychotherapy. Psychotherapy is a general term for treating depression by talking about your condition and related issues with a mental health professional. There's also other treatment options, which are electroconvulsive therapy and transcranial magnetic stimulation. Some examples of complications associated with depression include excess weight or obesity, which can lead to heart disease and diabetes, pain or physical illness, alcohol or drug abuse, anxiety, panic disorder of social phobia, family conflicts, relationship difficulties, and work or school problems, social isolation, suicidal feelings, suicide attempt, or suicide, self-mutilation such as cutting, premature death from medical conditions. Prevention. There's no sure way to prevent depression. However, these strategies may help. Take steps to control stress, to increase your resilience and boost your self-esteem. Reach out to family and friends, especially in times of crisis, to help you weather rough spells. Get treatments at the early sign of a problem to help prevent depression from worsening. Consider getting long-term maintenance treatment to help prevent a relapse of symptoms. This is the end of my video presentation. If you're feeling depressed, please seek for help. There's nothing wrong with it. Don't be afraid or ashamed to ask for help. And here I wrote a national suicide prevention lifeline.